Welcome back. Now, the county government of Trans Nzoia has issued a cholera outbreak alert following the confirmation of 7 cases at the County Referral Hospital as of 1st March 2018. In a press statement Friday afternoon, County Director of Health, Dr. Gilbert Sowon, said the disease has been traced to all the sub-counties within the county. Cholera is an infectious disease that causes severe, effortless rice, watery diarrhea, which can lead to severe dehydration and even death if untreated. It is caused by eating food or drinking water that is contaminated with bacterium called vibrio cholera. Now, the County Director of Health now wants any persons aged 2 years and above presented with an acute profuse water, diarrhea and vomiting to present themselves to the nearest health facility for treatment. And as we try and keep tabs with the situation in Trans Nzoia, I want us to speak to one of the CECs, Christine Tanguli. She's joining us live by way of phone from Trans Nzoia. A very good afternoon to you. Thank you very much for joining us here. What is the situation currently since this particular statement was released on the 1st March? What has happened between then and now?
Okay, thank you so much. Hello?
I can hear you. Just kindly give us a situation update of how things are in Trans Nzoia as far as the cholera outbreak is concerned.
Okay, thank you so much.
Yes.
We have since past when the report of 7 people, we have had actually the number went up to 37. But fortunately, we have been able to contain them. There had been admitted 37 people. Right now, we only have 5 in the hospital, but we were able to discharge the rest who are who are okay. And even the 5 who are in hospital right now are in stable state.
Yes.
Just an hour ago, I've been informed that there is one more outbreak in Sinoko area, which we have already sent our team there. They are already moving to the ground. But even in the rest of the places, like Saboti, we had 29 cases. Cherengani, we had 4 cases. Kwanza, we had 2 cases. And Kimini, we had 2. That's what gets us to 37. But so far, we only have 5 in hospital. And then the officers are on the ground. The places we have mentioned, our officers are there. They are very vigilant, trying to help the treating of the water in those areas, just making sure that people are drinking clean water. We have been on media. I have been on media telling the people of Trans Nzoia to be able, sensitizing them on the same and telling them that we have closed down the public eating places. That's one thing that we put in place. We have closed down and we are still closing down. And we are telling people not to eat anything that is being sold by hawkers.
How many places, public places for eating have you closed down? And so far, are you seeing any results of some of the actions you have undertaken as a county government to cushion residents from this particular outbreak?
Okay. In town, we've actually closed all open eating places. Any open eating place, because you wouldn't be able to quantify, because some of them are actually like 5 people seated on a row. And you wouldn't even know whether they are just 5 or 10, but we have tried our best to close all open eating places that are on the street. We have been able to also stop hawkers from hawking anything that is edible.
All right. Thank you very much for speaking to us here on KTN News Desk. That is Christine Tanguli, is a CEC Health at the Ministry in the County